All right, so we're paging you. Hey Doc, this is Julie in the PACU, and I've got Mr. Smith now. He's now 2 hours post-op from the thrombectomy and small bowel anastomosis for mesenteric ischemia. You saw him 30 minutes ago for his post-op check. At that point he was doing well, vitals stable, heart rate 100, blood pressure 110/80, complaining of some abdominal pain, which I gave him 4 milligrams of morphine for. Now Pat has a heart rate in the 130s, blood pressure 90/60, respiratory rate in the 30s, and decreasing O2 status. What do you want me to do, Doc?
Could we get a new EKG?
Okay.
12-lead EKG.
Okay.
And then could you give me his most recent I's and O's and his most recent vitals? Or actually, you just told me his most recent vitals, but his most recent I's and O's?
Yes, he is actually on a heparin drip. He's on D5 half normal saline running at 150, and he had 15 mils out in amber looking urine. This last hour he had 100 mils out in yellow urine the hour before that.
Okay.
And that's what I've got so far.
So he's outputting a decent amount. Wonderful. I'll come and see him right now.
All right, thank you.
Thank you so much. Hello, Mr. Smith. How are you?
And just to clarify, Doc, that last hour was 15, not 50, so 15
Oh,
mils,
15.
not 50.
I'm sorry.
Yeah.
I see. Thank you.
Yeah, when you said it was sufficient, I figured
Yes.
you may have heard me say 50.
Correct.
It's 15.
Wonderful. Hello, Mr. Smith. My name is Neil. I'm your medical student that's on service today. How are you feeling?
I don't feel too good.
Yeah?
It's, I'm very out of breath.
Yeah.
Hard to breathe.
Hard to breathe? Okay. Well, how about you just rest for now? I'm going to take a look at your vitals again real quick. He's still tachycardic and AFib. And, his SpO2, I don't like that much. And he's now...
He's on room air.
Room air.
What'd you like him to be on?
Yeah, could we actually, since he's at 85, 86, could we just go straight to the non-rebreather?
Okay.
And then crank it up to
10 liters at least?
Yeah.
Okay.
And then his blood pressure.
Okay.
The last blood pressure you gave me was 130.
His heart rate was 130, but he was 90/60, so he's even gone down a little bit since we've talked.
Okay. Can we give him a 500-liter bolus and see if that helps?
Okay.
And then,
500 liter or mils?
Oh, I'm sorry, milliliter. And see if that helps his blood pressure. And his temperature's all right. You said his eyes and nose. The nurse has been telling me that your urine output has decreased, and so I'm just gonna ask again and see if that has been a trend. Before your surgery and then during your surgery and after. Okay, just hang tight, Mr. Smith. What was his eyes and nose trend?
Looks like I said, he was 100 out in urine last hour, but the hour before, but now he's just out 15.
Okay.
I know he had 300 out in surgery, and they gave him 2 liters of LR during surgery, and he had 1,000 mils EBL in surgery. And let's see, it looks like his pre-op CBC, the H&H, was 11 and 35.
Okay, could we actually get repeat CBC?
Sure.
As well as a new BNP,
Okay.
just to check his electrolytes.
Absolutely.
And then also, who checks his? That'll all come in the BNP, his creatinine and everything. So I want to take a quick listen to your lungs. Just want to reassess, make sure that nothing's happening with your lungs or respiratory system. Okay, Mr. Smith. Okay. Alright. I'm just going to examine your abdominal wound, okay?
Oh, that looks good. Looks really good.
Wonderful. Alright, Mr. Smith.
Looks like the CBC, the H&H came back 8 and 26. Everything else was within normal limits.
Okay, so he, it seems to me that his hemoglobin has dropped a little bit.
Yeah, it looks like he dropped 3 points.
Mm-hmm. So,
his blood pressure looks better.
Yeah,
his SATs look better, so that's good.
Yes, 100% agree. I think that unfortunately, given his recent surgery and his drop in hemoglobin, something we have to consider is he bleeding out somewhere, or is he maybe does he have an anastomotic leak or something?
How are we gonna figure that out, Doc?
So we can do a get an additional abdominal series?
We can. He had an X-lap, so he was pumped full of fluids and air. So I
Yes,
think
you're
that's
right.
all we're gonna see is fluids and air.
You're so
But
right.
he had a 3-point drop in the H&H. I'm wondering if this just needs to be caught up from surgery, or if, like you said, he's still bleeding. How could we figure that out?
Well, we can look at his estimated. We can look at how much he lost in surgery.
Yeah. How many points?
So-
how many points should that have been?
It should have been around 3 points, I suppose, because you lost 1,000, right?
Yeah.
And so, given that
Yeah, he probably just needs to be caught up then.
Yeah, I
This is
agree.
what it sounds like.
So it looks like that's actually an adequate drop in hemoglobin.
Okay.
In
What do you want me
terms
to do, Doc?
In terms of his respiratory status, he seems to be doing much better on the non-rebreather. His blood pressure's coming up. His heart rate's managed. I think that the last thing we could possibly do is give him some red blood cells.
Okay.
Just because he did lose quite a
Yeah, he
bit.
probably just
and
needs to
so
be caught up.
Yeah, I think that would be the best thing.
How many units would you like me to order?
We could do 3 units.
Okay. And then would you
So-
like me to repeat the CBC when those are
Yes.
in? Okay.
Yes, that'd be great.
All right, Doc, I will
All right.
repeat that CBC and I'll give you a call then when those that CBC's in.
That sounds
I'll
good.
go ahead and blow that blood in for you.
All right, thank you so much.
You're
Thank you,
welcome.
Mr. Smith.